Okay, so welcome back, guys, to another session of Physio Quiz. So today we'll have CBS and renal physiology questions. So let's start. So here's your first question. The plateau phase of the cardiac action potential is mainly due to easy question to begin with, and I think this is also a P by Q. So think about the ion channels which are responsible for maintaining a sustained depolarization in the ventricular myocytes. So right. The answer is influx of calcium ions. Okay. Okay, let's move on to the second question. Okay, a 55-year-old male is brought to the emergency department with acute chest pain. His ECG shows ST elevation. Despite aggressive treatment, he develops hypotension and bradycardia. Which of the following best explains the bradycardia? So, focus on which part of the heart, if infarcted, would disturb the autonomic regulation of the heart rate. Okay, right. It is basal gyrus reflex. Here's your third question. A 58-year-old man presents with chest discomfort on walking that is relieved by rest. ECG show no acute change. He is diagnosed with stable angina. Which of the following is the most appropriate initial treatment to relieve his pain? I think you'll easily get this. Right, it is nitroglycerin. Okay, a 65-year-old man presents with progressive breathlessness and pedal edema. On examination, JVP is elevated and shows a prominent V wave. So, which of the following is the most likely diagnosis? So, this is actually a very important question. A large A wave, large B wave, absent A wave, canon A wave. Yeah, the right answer is tricuspid regurgitation. In tricuspid stenosis, we get a large A wave, right? Okay, moving on to the fifth question. A 70-year-old man presents with sudden onset palpitation and dizziness. His ECG shows absent P waves, irregular RR interval, and narrow QRS complex. So, what is the most likely diagnosis? So, this arrhythmia is more common in elderly patients and increases the risk of thromboembolism. So, thromboembolism means you have to narrow down to one option, that is, yeah, atrial fibrillation. More commonly seen with atrial fibrillation. Okay, at the end of five questions, we have Aisha leading the quiz, and in the second place, we have CK, and Krishna is in the third place, followed by S, Sharanya, PKSM Sai, PN, Ramkeshav, Chennai, Dr. Rajtak, Pakya, Naga. Okay, I am back with emoji. Okay, X. Okay, let's see the sixth question. A 16-year-old girl presents with shortness of breath on excision palpitation. She had a history of sore throat 6 months ago. So on cardiac examination, mid-diastolic murmur is heard best at apex in the left lateral position. So what will be the diagnosis? So you need to find out with the valve. So this, as you know, this is a sequel of rheumatic fever that commonly affects one of the valves here, right? It is mitral stenosis due to RHD, which is more commonly seen. Okay, here's your seventh one. The 5-year-old medical student volunteers for dehydration study. After 24 hours of no water intake, which of the following changes is most likely seen in his kidneys? So if you know the mechanism well, then this is an easy question. So this is a hormone that would increase to conserve the water by acting on the collecting duct. Okay, one more to go. Yeah. So the right answer is increased aquaporin insertion, okay, in the collecting duct. Okay, the next question is a 30-year-old man presents with severe dehydration after a bout of gastroenteritis. His urine is found to be highly concentrated with low volume. So which hormone is most likely elevated in this condition? So again, a similar question. So to give a clue, it's secreted from the posterior pituitary gland and plays a major role in water retention. Right, it is ADH. And one more important concept related to ADH is ADH agonist, antagonist, and their therapeutic uses. That is tolvaptan, desmopressin, terlipressin, all those drugs. Okay, ninth question. 22-year-old man presents with hematuria and hemoptysis. So chest X-ray shows bilateral infiltrates. Kidney biopsy show linear IgG deposition along the GBM. So what is the most likely diagnosis? So there is a linear deposition on the GBM. So think of a condition where antibodies target both lungs and kidneys here. Okay, I guess this is the easy answer. That is Goodpasture syndrome, right? Okay, the last question. A 60-year-old man with chronic kidney disease developed headache, vomiting, confusion within 30 minutes of starting his first hemodialysis session. So, what is the most appropriate next step in management? So, to give a clue, this is a complication of rapid osmotic shifts. Treatment usually involves slowing the diagnosis, okay? And we have to manage the raised ICT. This is also one of the PYQ. Right, we administer mannitol and we reduce the rate of dialysis. So this is, can you tell me the diagnosis for this? Okay, so let's see the winner. So CK is the winner of the quiz today. So congrats, CK. And we also have yes in the second place and Krishna in the third place. So congratulations. And we have Aisha, Sai, PKSM, and back with emoji, BN, Sharanya, X, Pakya, Naga, Dr. Reedstock, Ram Keshav. Okay, so that's it, guys, for today. So that was a wrap for CBS and renal physiology. Even though the questions were easy, we actually revised it once again. So it is a form of revision itself. So uh, okay, so we'll see you in the next session. Okay. Until then, keep revising, keep studying. Good night.